This segment is sponsored by InsureItForward. You know, experience counts, especially when you're trying to get the right insurance. Joining us now is Jim Shine with InsureItForward. It's a local insurance agency out of Edmond. Jim, welcome to Living Oklahoma.
Well, thank you, Amy.
We're so happy to have you because this is really the first of a 5-part series that we're doing about insurance. So tell us a little bit about yourself and also InsureItForward.
Right. Again, my name's Jim Shine, and I started the insurance company about 30 years ago with Mutual of Omaha. Once I started with Mutual of Omaha working for one company, I found out pretty quickly that you really can't serve your clients the best if you only have one product, because not one thing fits everybody.
Right.
So that's when I became an independent agent. And then right around when right before the Affordable Care Act started is when I started InsureItForward, because it was so confusing. We just kind of started figuring out a way to help people survive Obamacare or the Affordable Care Act.
Yeah.
Then I kind of went back to my roots and went back to Medicare as well with Medicare Advantage plans.
Okay, yeah, let's talk about that real quickly. So a little bit about Medicare and also the Medicare Advantage plans. Who would be eligible for those?
Okay, so Medicare is the federal plan that insures almost everybody 65 and over, and it also includes a large part of the population that is under 65 but on Social Security for disability. Okay. And Medicare has 4 basic parts. You have your Part A and your Part A and your Part B, which covers your doctors and your hospitals.
Okay.
You also have your Part C, which is your Advantage plans, where you actually opt out of Medicare and go with a private company.
Okay.
You have Part D, which is your prescription drug plans. And then you also have Medicare supplement plans. So there's a lot of different options. Yeah. So it really takes it's kind of a process to find the right plan.
Yeah, so let's talk about that because it is difficult, and you did a great job really kind of breaking those down. But how do you know you're picking the best plan for yourself or your family?
So for each person, it's going to be different, and we look at a lot of different things. The main thing we want to do is we want to find the plan that's right for you. We want to find the plan that has your doctors, your hospitals, your prescriptions, your pharmacy. We want to find your plan. And for some people, that might be an Advantage plan. For some people, it might be a Medicare supplement. But we really got to take the time to figure out what the plans are. And most of the time, the biggest deciding factor is prescriptions, because the difference in prescriptions from one plan to the next can be your out-of-pocket is $1,500 a year with one plan and $10,000 with another. So you really want to find the plan that fits your needs.
Yeah, that's an important note. And it's not one size fits all. You do have to really gauge the person and their needs. All right, so you know, we see a lot of ads with aging celebrities. They get countless phone calls. You know, they're talking about Medicare and that there are advantages going on. So how do we know how to decipher between those celebrities and those ads and those phone calls? What's real, what's not?
and that is a really hard thing to do right now. And it's crazy right now. You almost don't even want to turn on the TV because that's all that's on.
Yes.
But there's a couple different parts to that particular question. The first part is, well, to answer your question, no, there's no advantage to going with those plans.
Okay.
Health insurance is a little different, especially in Oklahoma. Your cost or the insured's cost is the same, whether they buy it directly from the insurance company, from a national company, or from a local agent. So, and when you buy it from a local agent, you get somebody who knows what's going on in the medical community. We know who works with Mercy Hospital. We know, like right now, if Integris or OU or whoever's fighting with one of the insurance companies, we know those things. We keep up with what plans use local pharmacies, because you may want to use your local pharmacy, not one of the big box stores.
Yeah.
So we keep up with all those type things. One thing that I've already been asked a couple times just since open enrollment started is, God, Jim, is it going to cost for you to come out and do all this work? And no, at least with InsureItForward, we never charge for our services. We're paid directly by the insurance company, regardless of which company. But to get specific on the phone calls, those drive me crazy. Yeah. I got 7 yesterday.
Yeah.
I think 3 or 4 of them were on my business phone.
Oh my gosh, Jim.
I'm pretty sure my business isn't 65 and doesn't get Medicare. So most of those, what really bugs me is they try to make it sound official, like they're with Medicare something or other.
Right.
They're not. Medicare is not going to call you.
So Jim, I think the best thing to do is for people to call you. Great information today, because instead of reading through those phone calls, just call you guys. And you can find out more about InsureItForward, health insurance agents with a cause. You can call them at 405-585-0648. You can always check them out online as well at InsureItForward.com.